Possible tear trough deformity? Hello, I'm a 29-year-old male, and over the last month, I've noticed that discoloration, bagginess, is developing under my eyes. In the attached pictures, the bags seem more ruddy in color, but in the mirror, they look a bit darker, dark bluish. The eyelid skin itself seems quite thin. I do not have allergies in my eyes, while a bit dry sometimes, give me no other problems. Any responses would be greatly appreciated.
Thank you for your question. You're 29 years old, you submitted several photos, and you're concerned about the appearance under your eyes, which you describe as baggy and discolored with a little bit of a bluish appearance, and you're asking about a tear trough deformity. And you state in your description that you don't have allergies. So the question is, what's your condition? What should you do? Well, just to give you a little background, I'm a cosmetic oculofacial plastic surgeon and a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. And addressing under-eye aesthetics is a very significant part of my practice. And figuring out the right combination of solutions is something we do every day. So at 29, you're noticing this puffiness. So let's define what's the puffiness. The puffiness is lower eyelid fat prolapse. Now, lower eyelid fat prolapse means that the fat around your eyes has pushed forward and created this bulge. Now, that bulge is not from being overweight. It is puffiness that is due to fat that's normally around your eyes that just shifted forward. We often refer to it as herniated fat. This is typically a genetic issue. In other words, it tends to run in families. In my practice, I've helped people in 3 generations with exactly the same concern and issue, that with the onset occurring in around the same age range. Now, your question about bluish discoloration. Well, to understand that, in the absence of allergies or sinus issues, we have to think about what are we seeing? Why is it this color? Well, the eyelid skin itself is 0.5 millimeter in thickness. So where does the blue or the reddish quality come from? It's the transparency of the skin. The skin, especially in lighter skinned people, you'll see right through it, and you can see the muscle and the blood vessels underneath. Now, interestingly, you asked about tear trough deformity. So the paradox here is you have too much of a bulge in one area, and yet it looks hollow in another area. Well, this tear trough area you can think about is a valley that is adjacent to a mountain. So the relative contrast of an elevation next to a depression. In the modern world, we have more than a few options, and it depends on the degree of fat prolapse that I make the decision on whether or not to fill the valley or to reduce the mountain. In your situation, although I'm not doing a physical examination, I would probably say that you would be a candidate for lower eyelid transconjunctival blepharoplasty. Now, what that means is it's addressing the fat pockets. It's a surgical procedure. It's done from the inside of the eyelid to sculpt and reduce the fat in a way so that the contrast of the puffiness with this valley area becomes more smooth. And essentially, it's to help you look as if you never had the bags under the eyes. To help with skin quality and texture in our practice, we routinely use platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's using the wound-healing elements of your blood, both from the cellular side and the factors that are needed in wound healing. And we have found that in doing this treatment under the eyes, we improve skin quality. By improving skin quality, there can be benefit to the discoloration. We can't necessarily eliminate it because we're dealing with skin that's so thin, less than a millimeter in thickness, that you have to try to build up the skin quality in the best way that is within the skin's capacity to improve. A lot of times people's skin quality does diminish, as a side note, from environmental factors such as sun exposure and smoking. So if those are factors that can be contributing to your situation, you need to address that. So moving into that frame of mind, I would say that in our practice, what we would do for you is a procedure that, as I described, the transconjunctival lower eyelid blepharoplasty. We would do it under local anesthesia with light sedation. We prefer this. It's a much safer, in my experience, way compared to general anesthesia. Our patients recover a lot faster. There's no paralysis or tube in the throat that is typical of a general anesthetic procedure. Combine that with platelet-rich plasma. Depending on skin texture, we often also use something called fractional CO2 laser. But again, that's something that requires more of an up-close physical examination to look at the skin texture and quality. Now, this is in contrast to the alternative of filling. Filling the under eye area and the tear trough area is feasible up to a point. In our practice, we are seeing more and more patients who are having fillers placed in the tear trough area, particularly fillers in the hyaluronic acid family, such as Restylane, Juvederm. These are great treatments, but in the patients who have too much puffiness, those treatments tend to end up not working out so well because the amount of volume of filler needed creates even more swelling and puffiness under the eyes. So people come to us and we use an enzyme called hyaluronidase to actually dissolve that filler so that the eyes can actually be revealed and you can see what the real situation is. So there is an art to just making this decision, but I would say that just from your photos alone, my gut feeling is that the procedure is more likely to be beneficial. No one likes to have surgery, but a lot of people spend a lot of time and money and a lot of heartache trying to avoid it when that's a more definitive benefit. So now that you understand the anatomy and my recommendations, I would recommend you meet with qualified, experienced cosmetic surgeons. My bias is always towards specialists, people who have extensive experience and focus on eyelid surgery, and take a look at before and afters, get a sense of the type of anesthesia used, and most importantly, of course, be comfortable with the doctor. Don't shop on price, shop on quality and comfort, and you'll hopefully get the desired result you're looking for. So I hope that was helpful. I wish you the best of luck, and thank you for your question.